If you have ever wondered whether pills like Viagra or Cialis are secretly putting your heart at risk, you are not alone. I hear this worry all the time from patients and viewers who are anxious about blood pressure, palpitations, or a family history of heart disease. These medications have been surrounded by mystery for decades, and a lot of what gets repeated in public is simply wrong. So I want to clear the fog and give you a calm, evidence-based map of what these drugs do, why the myth started, and how to think about safety in a practical, grounded way. Let me start with the myth in plain language. Many people believe Viagra, Cialis, Levitra, or Stendra are bad for the heart and dangerous for blood pressure, and that heart patients can never take them. The truth is more nuanced. Viagra was originally developed as a circulation drug. Researchers hoped it would help angina, that squeezing chest pressure that comes from narrowed heart vessels. At the time, the standard treatment was nitrates like nitroglycerin. Nitrates relax blood vessel walls, which lowers blood pressure and improves blood flow to the heart. The problem was that the body adapts to nitrates over time. Like turning up the volume on the same song every day, you need higher doses to get the same effect. So scientists wanted something that could support circulation without that rapid habituation. They searched for a new biological switch and found an enzyme called phosphodiesterase type 5, or PDE5. Think of PDE5 as a drain in a sink. When the drain is open, a relaxing signal in your vessels disappears quickly. When you block the drain, that relaxing signal stays longer and smooth muscle stays loose. The first drug built to block PDE5 was sildenafil, which became Viagra. Newer cousins include tadalafil, vardenafil, and avanafil. They all work on the same pathway, just with different timing and duration in the body. PDE5 is not only in the heart, it is spread through smooth muscle all over the body, including the erectile tissue in the penis. So the early angina trials did not impress anyone for chest pain, but the volunteers noticed something else: stronger, more reliable erections. That side effect was the jackpot, and the research pivoted from heart to sexual health. It is one of those rare moments where failure in one area opens a breakthrough in another. Now, if these drugs relax vessels, why do people think they are dangerous? Because of one specific interaction. PDE5 inhibitors widen blood vessels a bit. Nitrates widen them a lot. If you take both together, the effects can stack and blood pressure can fall too low, too fast, even to life-threatening levels. In the late 1990s, some people mixed Viagra with nitrates for chest pain, collapsed, and died. Those headlines burned into public memory and the myth took off. The irony is that the danger was not Viagra alone. The danger was the combination. So here is the core safety rule. If you use nitrates like nitroglycerin tablets, sprays, patches, or long-acting nitrates, you should not take a PDE5 inhibitor unless your cardiologist has set up a specific plan. The same caution applies to certain non-selective alpha blockers used for blood pressure or prostate issues. Outside of those combinations, PDE5 inhibitors have a high safety profile for most people, and we now have more than 25 years of real-world data to back that up. In fact, these medications have legitimate heart-related uses. Tadalafil, or Cialis, is approved for pulmonary hypertension, where pressures in lung arteries are too high and the right side of the heart works overtime. By relaxing those lung vessels, tadalafil can reduce strain and improve exercise tolerance. In some types of left heart disease, PDE5 inhibitors have shown remodeling effects over time: better squeeze, less chamber stretching, and improved microcirculation. They also seem to calm inflammatory signals inside heart tissue, which matters because chronic inflammation is one of the quiet drivers of heart stiffness and fatigue. Researchers are also studying whether these drugs help in the period after myocardial infarction, meaning after a heart attack. Early evidence hints they could reduce infarct size and support perfusion, but this is still an active area of science, not a settled clinical rule. That is why most guidelines still say to be cautious in the months right after a heart attack. Not because the drugs are known to be harmful there, but because the timing window is delicate and we want the safest, clearest data before recommending routine use. These drugs also reach beyond sex. Tadalafil is approved for benign prostate enlargement because relaxing smooth muscle around the bladder and prostate can improve urine flow and reduce urgency. Some studies are even exploring PDE5 inhibitors in conditions tied to circulation and recovery, basically anywhere smooth muscle tone and blood vessel signaling matter. One mechanism, multiple applications. That is why I sometimes call PDE5 inhibitors a Swiss Army knife. Let me ground this with a quick mini case story. A man I will call Daniel came to see me anxious about ED meds because he had mild hypertension. He was also running on high-stress hormones, sleeping poorly, and skipping workouts, so his metabolism felt sluggish. He worried that taking a pill would trigger a dangerous drop in blood pressure or a heart attack. We checked his medications and confirmed he used no nitrates. We reviewed his last cardiac workup, which was stable. Then we talked about the bigger picture. His erections were not just a bedroom issue, they were a circulation issue. With his cardiologist on board, he started low, stayed hydrated, avoided mixing the pill with heavy alcohol, and, just as importantly, rebuilt his habits. Over a couple of months, his deep sleep improved, his energy and libido came back, and the medication became a tool he used occasionally, not a crutch he feared. Daniel is not a miracle story, he is a normal story. Safety came from context and from respecting how his body works. So what should you take away if you are considering these medicines? Or if you just want to understand how they fit into a longevity-focused life? Here is a simple educational protocol you can use for discussion with your doctor. First, do a medication and condition screen. Ask yourself, do I use nitrates for chest pain, or have I been told to carry nitroglycerin? Am I on a strong alpha blocker? If yes, this is a specialist conversation. If no, move to the next steps. Second, consider timing around recent cardiovascular events. If you have had a heart attack, unstable angina, or a major cardiac procedure in the last several months, do not self-experiment. Your cardiologist needs to guide the window and dose. Think of it like returning to exercise after an injury. The tool may be safe, but the timing has to be right for your specific recovery stage. Third, choose a conservative starting range. In clinical practice, starter dosages are often around 25 to 50 milligrams for sildenafil, about 5 to 10 milligrams for tadalafil, and similarly low starter doses for vardenafil or avanafil. Starting low reduces side effects and lets you learn your response. Never double a dose because you think more is better. Your circulation is not a volume knob you want to spin quickly. Fourth, schedule wisely. A light meal or empty stomach tends to make onset smoother. A large, high-fat meal can delay absorption. Sildenafil and vardenafil are often taken 30 to 60 minutes before activity. Tadalafil lasts longer, so people may take it 1 to 2 hours before, or as a small daily dose if prescribed. Either way, spacing from nitrates is non-negotiable. If you ever need emergency nitrate treatment, you must tell the clinician that you have used a PDE5 inhibitor recently. Fifth, track your body's signals. The common effects are headache, facial flushing, stuffy nose, or warmth, basically signs of vessel relaxation. Sometimes people notice mild backache or light sensitivity. If you feel dizzy, faint, or get chest pain, stop and seek care. Listening to your body is part of safe use. Sixth, stack lifestyle support for vascular health. Erections are a circulation event, so anything that improves vessels helps. Daily movement, even a 20-minute brisk walk, improves metabolism and endothelial function. Anti-inflammatory foods like leafy greens, berries, olive oil, legumes, and fatty fish support nitric oxide and reduce inflammation. Fiber and fermented foods help gut health and probiotics, which in turn influence blood vessel tone through the immune system. Many people also benefit from pairing meals with protein and colorful plants to steady blood sugar, because glucose spikes can damage the lining of vessels over time. Add mobility work a few times a week to keep tissues supple and to support recovery. Your arteries love movement the way your joints do. Seventh, prioritize sleep and minerals. Your arteries repair overnight. Deep sleep supports collagen maintenance and your skin barrier, and keeps stress hormones from spiking. If sleep is shallow, vessels stay tense and your nervous system stays in fight or flight. Many adults do well with magnesium-rich foods, like pumpkin seeds, leafy greens, beans, and dark chocolate, or a cautious supplement range of roughly 200 to 400 milligrams in the evening if their doctor agrees. Better sleep often means better sexual function with less reliance on medication. It also keeps your circadian rhythm steady, which is one of the hidden levers of long-term cardiovascular health and whole-body longevity. Notice the theme. These drugs are not a reckless heart gamble for most people. They are one tool that works best inside a bigger system aimed at vascular health, circadian rhythm, and long-term vitality. The real danger is mixing them with nitrates or ignoring recent heart instability. And if a clinician ever tells you they are unsafe for you, it will almost always be because of that context, not because the drug is inherently toxic to the heart. Let me end with a simple 3-step starter plan you can apply this week. Step 1. Review your meds and history and write down any nitrate use, alpha blockers, or recent cardiac events. Bring that list to your doctor if you are considering a PDE5 inhibitor. Step 2. Commit to one daily circulation habit. A walk, a bike ride, or a short bodyweight circuit, done most days. Even small improvements in mobility and blood flow add up. Step 3. Build a sleep anchor. Pick a consistent bedtime, dim lights an hour before, and include one calming routine like stretching, reading, or slow breathing to help your brain slide into deep sleep. If this helped you see the truth behind the myth, share it with someone who is still worried. I am Dr. Maya Reed, and I will see you next time.